welcome to this edition of the Town Hall for Healthcare Professionals. It is always a privilege to gather this community of committed professionals at home and abroad. We meet once a month and with a common purpose of strengthening the healthcare system in Cameroon. One of the core pillars of the Cameroon Town Hall has always been giving back. The idea that wherever we may be in the world, our knowledge, our experience, and network should continue to serve the communities that shaped us. We had this conversation 2 years ago where we started the foundation of giving back as a town hall. And through that initiative, a lot has happened back home. Members of the town hall, we are now 2,450 people who have attended at least one session of the town hall spread in about 36 countries. So each and everyone has a mandate to give back to the community that shaped him or her. Giving back is not simply charity, it is responsibility. It's about transferring skills, building systems, mentoring the next generation, and ensuring that the progress we achieve globally translates into better health outcomes for our people at home. Today's discussion reflects that spirit perfectly. We will focus on the upcoming ACPA 2026 cancer screening and advanced cancer education program in Buea, an important initiative led by the Association of Cameroonian Physicians in the Americas, in collaboration with the Regional Hospital in Buea and the University of Buea Faculty of Health Sciences. Cancer is rapidly emerging as a major public health challenge in Cameroon. Too many of our patients are diagnosed late when treatment options are limited and outcomes are very poor. Yet we know that early detection, strong referral systems, as well as trained healthcare professionals can dramatically change this reality. This initiative aimed to address exactly that gap by combining community-based cancer screening with advanced clinical education and multidisciplinary collaboration. It brings together physicians, nurses, trainees, and partners from Cameroon and diaspora to strengthen local capacity while directly serving the patients back home. What makes this mission really particularly powerful is that it moves beyond one-time outreach, right? So they are also going to train people, transfer knowledge, and system strengthening, so ensuring that the impact is continuous even after they leave. So tonight we shall just look at the vision behind this initiative. Who are those behind it? How did they come about it? And how will it be implemented? And so I think this is going to really be an interesting conversation. And today we have the executive of the association, ACPA, and I will be having the honor and delight to welcome Dr. Eugenia Ndi, who is the president of this really prestigious organization. And I think it's a great initiative. Thank you for your leadership and thank you for thinking about home and for carrying this very noble mission. So I'll take this opportunity to welcome you all once again, ladies and gentlemen, to this session. And I pass over the microphone to Dr. Eugenia for a brief presentation of this mission, the initiative behind it. And thereafter, we shall also hear from our own chair, Dr. Muna, who happens to be one of the outreach coordinators for this really great association. So thank you, and over to you, Dr. Eugenia.
Great. Thank you for having me. Good evening, good afternoon, everybody. This is a very great time to be a Cameroonian. I think we are full of so much expertise that we can give back to our community. And the ACPA is just one of those. And I want to thank the Cameroon Town Hall for all what you've been doing for the past few years. And it is no coincidence that the ACPA is here. We're here for the first time, but this will be divided into two sections. I will be able to let you guys know the organization ACPA and what we're all about. And then in the other session, my medical mission chair, Dr. Muna, who also happens to be chair of this town hall, will give a brief overview of the activities that will be done in Buea in detail, and hopefully we'll be able to answer any questions. I also see some members of ACPA that are here, And then some of those members will be participating during this outreach in Cameroon. And so I'm excited to see a lot of you here, Dr. Benjamin Babi, Dr. Nadesh Fakche. We'll get into the details and be able to answer some questions that I think maybe some participants may have for you guys specifically. So the Association of Cameroonian Physicians in America has been ongoing for about 10 years now. As a matter of fact, we'll be celebrating our 10th anniversary in Atlanta in April. This association was formed initially based on the need to bring together physicians from Cameroon origin with 5 specific missions. Our first goal was to foster personal and professional development between physicians of Cameroon origin to put them in a space where they can network and collaborate with each other. The second aspect was to be able to integrate physicians that are trained in Cameroon or in other parts of the world that are of Cameroonian descent to integrate into the US medical system. And we can tell that we have been very successful in those first 2 missions that we have. And I'm proud to say that we've had at least about 35 residents integrated into the graduate medical system that passed through ACPA. And one of ours, Dr. Muno himself, benefited from the mentorship that this organization provided. And today he's in a position to be given back, which just speaks for what we do stand for. Our third mission is to provide a forum where physicians can debate healthcare issues that are affecting Cameroonians, both here in the North America and back in Cameroon. And the next aspect, our last 2 missions, which is what we're focusing here about, is to provide a forum for involvement in healthcare delivery in Cameroon, as well as shaping policies, being involved in those places where we can participate in improving policy. And also, lastly, by helping to train physicians in Cameroon, where they can remain in Cameroon to provide the care that our relatives so deservingly need, and also be able to train their own colleagues coming up after them. So it is in this light that we have initiated this landmark work that we're about to go do in Cameroon. The ACPA has been involved in Cameroon in many other aspects. This will be our first physical presence in Cameroon. But before now, we've had many other collaborative initiatives with many other different organizations that are already on the ground. We've worked closely with the ASCOVIM organization of Dr. Buea. We've worked closely with other foundations like the EA Foundation. I rep Cameroon during the COVID pandemic, and other smaller non-for-profit organizations that we have assisted in one way or the other to promote the initiatives that we think that meet our vision. So for today, Dr. Muno will present to you guys the landmark initiative that we have, and I'm going to be back in Cameroon in the next week and a half, I should say. I'll pause. I know there'll be a lot of more questions that will come as far as an ACPA, the organization, what we do, how we do it. And I should mention that we have about 150 registered members of the ACPA spread across 23 different specialties, from surgical to medical and across the board. So we're a very diverse group of physicians and ready to give back to our nation, Cameroon.
Wow. Thank you so much, Dr. Logina, for your leadership and for really taking time to tell us about this organization. Quite a very big organization with that number of registered members. That's really, really incredible. Thank you for starting this session with this really great introduction. I will hand over to Dr. Muno to do the presentation.
Okay. Can you all see my slides?
Yes.
Okay. Let me go to the slide form, please. Sorry.
We see the flyer of the town hall. Not sure if that's a first slide.
Yes, that is the first slide, but
Okay.
let me stop. I cannot see it on my end, so just give me a minute.
Okay.
Let me share this. Okay. So, okay. So I just want to thank Dr. D for her wonderful leadership in ACPA, and also just want to acknowledge the presence of uh, our own father, who is not of him, ACPA is not going to exist. That's going to be no one other than Professor Malfobi. And also all the other ACPA members, and especially those who will be traveling to Cameroon with us. Dr. Fakche, who is a surgical oncologist, Dr. Vabi, who is here with us, who is a colorectal surgeon, Dr. Strong, who is also a surgical oncologist and a palliative care specialist, and Dr. Efwa, who is a gynecologist and obstetrician, and Dr. Foyon Kennedy. So I think this is a very important time for us to decide on giving back to Cameroon. The Association of Cameroonian Physicians in the US has been very instrumental, and I think it's the most instrumental in making me what I am here in the US today. A lot of the members here were helpful in guiding me, providing letters of recommendations, and getting me to integrate in the US. And that has been a very important mission that ACPA has had over the past years. So we've been looking forward to bringing ACPA into the town hall, Elvis. Like, it's been something we've talked about a lot of times, because, you know, when you're part of something, you tend not to want to bring them to discuss about it, but it's a very, and I'm encouraging all the physicians who are here, who are in the US, to join us. There is no way you can impact the community alone as you can do as a union force that you can reckon with. And I think ACPA is that force, one of the forces that can really change healthcare in Cameroon. And right now, it's the Minister of Public Health has as a mission to integrate the diaspora very strongly into the healthcare system. So I got a communique from the minister, who is very interested in what ACPA is going to be doing back home. So what are we going to do back home? So ACPA decided we're going to do several missions in the future at different levels. Cameroon needs us. So as Kennedy said, your country needs you. It's time for us to move forward. Marshall also said that in World War II. You need to know, ask yourself, not what your country has done for you, but what have you done for your country? So this is really one of those times we need to ask both questions. So ACPA decided that we're going to carry out a cancer screening and advanced education program in Buea. The question becomes, I know a lot of people are, why Buea? A lot of people have asked me, why Buea? Why not Bamenda? Why not Yaoundé? Well, there is no discrimination in this. The reason for Buea is that Buea was a little bit stable. If we could do it everywhere in Cameroon, we're going to do it. We're starting a model. A lot of those in ACPA did not train in Cameroon. They actually train in the United States. And this is a fact-finding mission for us to go home, see how things are done. How are we going to influence things in the future? How are we going to, because the reality is different for a lot of us. Some people have worked both in Cameroon and in the US, like myself, but not everyone in ACPA has done that. So we need to go see the reality. And I really want to thank all those who volunteered their time. So those in Bamenda who are feeling left out, we are coming, okay? We just need things to be stable. We're going to be there. Those in other specialties, we are also coming. So we have a lot of cardiothoracic surgeons. I think ACPA has the highest number of interventional cardiologists that I know. So we have several specialties that we can actually influence care, surgical specialties. So we're going to do an integrated model of cancer prevention, early detection, clinical training, and multidisciplinary care. This is going to highlight screening, which we think we cannot carry out a campaign like this without the locals benefiting. ACPA emphasizes, the board emphasizes that anything we do in Cameroon should have an impact on the population of Cameroon. And at the moment, from the best of my knowledge, we do not really have a screening guidelines for any cancer which is done in Cameroon in general. So we are going to use this model and later on send an advocacy to the minister for us to be able to integrate regular screenings as part of the healthcare model in Cameroon. We're not just coming into parachute. So this is going to be a program that we're going to integrate the hospital, the regional hospital of Buea, and also that of Limbe, but the that of Buea principally. You'll be having screening sites in both the private sector, which is Clear Radiology. They are the biggest imaging center in the Southwest. That's why we decided to use them. And we'll carry out an educational program, which I'm going to go detailing into. And we'll also carry out practical sessions, especially by the surgeons. And we may do some surgeries. And these are very highly trained surgeons, complex surgeries that you cannot imagine they can all do it. Now they need to go see the environment and see what we can do. Dr. Vabi is very anxious to go hands-on and take on any case. I think Dr. Factory also and Dr. Strong, we are willing to get our hands dirty. Let me say, as Vabi said, get our hands dirty and get things done. So we have done all the necessary administrative things that are needed for us to be able to do that. ACPA has so many other members who could not make it, but I just want to thank them. We would also try to get into starting a multidisciplinary tumor board in the Southwest region, which we can use. Tumor boards are already going on in Cameroon, but we want to redefine that. Now, here, just I'm sorry, but I had to put the faces of those who will be paying their transport out of to get into this, to do this. So what are the challenges in Cameroon? What led us to do this? Cancer burden is rising, especially for breast cancer. If you are not aware, I am involved in multiple tumor boards in Cameroon, including La Quintini and Bingo and the Bamenda Regional Hospital. Every day I get calls to help with the management of several cases. So there is cervical cancer has been stable, but it's still very high. It's the most common cancers in females. It's a gynecological cancer, prostate cancer for men, and the rising prevalence and of colorectal cancer. Late presentation. We had several meetings, and the doctors told us most of the time, the surgeons and the director of the regional hospital, the time they meet colon cancer is only when patients come in with occlusions already, or they come in with abdominal pain and you realize they have metastatic disease, or they come in with ascites. There is limited screening coverage going on. In the Southwest region, there is no area where we could do a colonoscopy. Can you imagine that? That is not supposed to be that way. So we need to advocate. There is no screening there used to be. Now the minister actually made the availability of a mammogram in all the 10 regions, which is good. Now we need to be able to educate people to go get that done. Fragmented referral pathways. People get a diagnosis, but they don't know where to go. They are stranded. And we also want to increase the oncology knowledge gap in order to prevent these cancers. Now, semi-urban and rural populations are also disproportionately affected. Those in rural areas, most of the time, it's always about witchcraft. People die and people still think about that. Well, most of those patients had cancer. So what is ACPA proposing? We understand very well that free things are usually not very sustainable, but we're going to start free for now. Free and subsidized screening for the 4 high burden cancers. For breast cancer at the moment, to be able to do a screening for breast cancer in Cameroon, the average price is about 17,500 CFA. ACPA is going to do a subsidized screening for breast cancer for 3,000 francs. And I want to thank the director of the regional hospital in Buea and also thank Clear Radiology for being able to help us do this with subsidization from ACPA and their part. We are going to do advanced disease-focused education for local health workers. And we really want everyone to be able to come in. Those who are free and available, especially our medical students and our primary care providers, please, we want you in Buea. Real case tumor board and structural referral pathways will be done. We would also have surgical interventions. Right now, my president has done a lot, Dr. D, in order to get us clearance from the Cameroon Medical Council. And the minister just promised me that if we have any problem with that, we should give him a call. If it's not out before we come, and he doesn't know why it should not be out. Then a scaled model for future cancer control in Cameroon. Those are the things that we are going to plan on doing. Then what are our program goals for the March 2026 program? Detection of cancer early in the community, then build a community program that is backed by the regional hospital for continuity, build a practical cancer care skilled in those who are back home, demonstrate multidisciplinary guidelines-based care. I trained in Cameroon, but one thing we lack is working together. Everybody thinks they are the most important and they work in silos, and which is really what is affecting our care. The oncologists who are trained feel that cancer is just for them. That's what the permanent secretary told me personally when we went and met her. She's like, I don't understand. Being maybe a pathologist, oncologists are actually guiding this field. Well, it's cancer care. I'll tell you, as a medical oncologist, we cannot do anything without the radiologist. We cannot do anything without the pathologist. My famous professor said, no tissue, no issue. Tissue is the issue. So pathologists are as important, radiologists are as important, all the different subspecialties. When they call me when I'm on call, oh, we have a lump. I'm like, where is your lump in the lung? I say, call the pulmonologist. It's not me you have to call. It's not yet cancer. Oh, we have a mass in the liver. Okay, what do you want me to do? The internist needs to know what to do. If it's cancer, then they're going to call me. So it's a field where everyone is important. Now, we're going to demonstrate multidisciplinary guideline-based care. We'll strengthen referrals and follow-up systems. We'll work with our local partners. We'll generate learning for future regional programs and general programs in community. And we're going to work, the community is going to benefit now. We'll build capacity and we'll also learn from them while we come back home exactly what we can do. Now, I would lay a little bit of emphasis on how the day is going to go. We will be starting, the 23rd is going to be the day we're going to do a little fact-finding. That's Country Sunday in Buea. We'll do a little fact-finding mission where we would go around, look at the theaters, look at the areas, know what is going to happen. The screening part is going to start on Tuesday, the 24th, and we'll continue till I put Thursday, but not true. We're planning on continuing till the funds are over. So that's really what we're going to do. Daily screenings for all 4 cancers. You have clinical breast examinations, plus or minus ultrasounds and mammograms. We're going to use the WHO guidelines in order to do screening for these women who are above 40. And WHO still says 50, but we're striking a balance. Women who are above 40, that's the American system. We're going to get a mammogram for those who are available. They'll pay a little token, and we'll get that done. Depending on how things are, we're planning to do mammograms for over 300 women or more. If there is more finance, we'll keep going. So we're trying to do that. Cervical cancer screening will be done, digital rectal examination and prostate cancer screening, and then Colorectal, we have a little bit of a problem. We've not been able, fit testing would have been the best, but we'll do focal occult. And we also have certain partners who are able to do colonoscopies in Douala, which we're going to do referrals to them. So, screening team operates independently of the lectures, but our lecture faculty would go back and be involved on how this is going to be done. Now, the educational program is going to be daily symposiums at the University of Buea with practical sessions also happening. There will be deep disease-focused learning, hands-on workshops, and case discussions. Practical decision-making in resource-limited settings. Friday, we're going to have a multidisciplinary tumor board case presentations and discuss how we're going to do with tumor boards moving forward. The knowledge is designed to translate immediately into practical sessions for physicians, nurses, trainees, and all staffs, and even patients who want to come in and be with us. So here is just showing you the different lectures. I think some changes we made on this program, but Tuesday is going to be a breast day. I think colorectal day is going to be Wednesday. So take this, this was going to be Wednesday, it will be a colorectal day. And then Thursday will be cervical and prostate cancer. And Friday will be multidisciplinary tumor board session. I'm excited to say that we have wonderful partners back home. And here is not the full flyer. We are still working on the real administrative structure. You'll see a flyer come out one of these days, because the flyer is going to have the Minister of Public Health presence in it, but we don't know yet if he's going to be there in person. So I just want to leave that. But he is an advocate of this program and wants ACPA to know that if there are any hindrance in getting this done administratively, he is available to intervene. The Vice Chancellor of Buea also will be doing a keynote speech during this presentation. And I want to thank Professor Hale from the bottom of my heart for being very open and not being very Cameroonian, and not just being the person he is and accepting projects like this and being able to run with it. And I would also thank Dr. Mukake Divine, who is the director of the hospital, who has also put the hospital resources in place and has helped in order for us to do this. Now, we do have clear radiology. Sydney Taze for giving your structure for us to be able to carry this out, because Buea alone, the regional hospital, will not be able to screen all these patients. So we want to thank you. Not forgetting every single person who is here who is going to provide us lectures. Dr. Yauba Seidu, who is the director of the Clinton Initiative program in the Central Africa. He is going to be there in present, and he's going to provide us lectures and also maybe in kind donations from the Clinton Foundation. And Dr. Joshua Tambe, you are a pillar, a doer, someone who gets things done. So this program in the ground has been totally done and put in place by Dr. Tambe, who is going to be part of, who is the main person. He just sent me some flyers. He sent me some banners that are already at the junction of UB and also at the junction of the faculty. So all of that has been done. Now, not forgetting I did mention all our members who are truly part of this, who are coming from the US. But we do have Dr. Wilfred Musi, who is the director of Cameroon Oncology Center. I mean, that's the most integrated cancer center other than Bingo, but they are better because they can do radiology. He's going to be there in present. He told me during that period, they will be having the Cameroon Oncology Conference, but he told me, Dr. Kenny, je ne peux pas manquer ça. He cannot miss this because he thinks it's going to be an opportunity for him to tell us what they do and also share their experience. He's going to give a lecture of radiation oncology presence in Cameroon, the problems they have. Cameroon has just one linear accelerator. We have a Cobalt machine in L'Hôpital General that is not working most of the time. And so this is a good opportunity for us to hear. We have Professor Gatre, who had to change his schedule so that he's going to be with us. And he's a gastroenterologist, and his clinic is going to be also part of the referral, the prime clinic, which is in Douala. Then we have Professor Waleji, who will be present. We have Professor Stephen Gogomo. We do have Dr. Tonsi, who is a clinical radiation oncologist at Bingo. He's going to be doing a presentation on the situation they have. He's a clinical radiation oncologist, but he can only see cancer patients and help with clinical work because they don't have a linear accelerator. They have their needs. They are the most integrated cancer center in Cameroon. You do have Dr. Tim Fabrice, who is a general surgeon with interest in surgical oncology. He's the vice president of ASCOMA. They have done ASCOVIM. They have done multiple cancers, and he's going to provide us their knowledge. Then Dr. Raymond, and you do have who is an anesthesiologist and also pediatric, and with multiple interests and also multiple knowledge that he trained in Cameroon. Later on, went to Australia and South Africa for sub-specialization. He has returned back home. This guy loves Cameroon and wants to give back. He didn't run away. Then you have Professor Rosemary, who is with the US Embassy, and she will be there. And I think I've talked about everyone. Now, what are the primary audience we're looking at? Is community members are eligible for cancer screening. We have the surgeons, the physicians, nurses, midwives, residents, students, and even the lay public, if you want to know anything that's happening. Allied health professionals, public health team, and advocates, and those who are also survivors. We think we'll be having some survivors be with us. Expected outcomes is to increase early detection, improve clinical competency, stronger follow-up systems, better multidisciplinary collaborations, a scalable model for the future. Partnerships, we're planning that ACPA is going to get ACPA leading implementations, partnerships with Buea, partnerships with the different associations that are run by medical students also, partnership with Clear Radiology, additional engagements with multidisciplinary teams. The US Embassy, we had a meeting with them, so they know we're going to be present, and a lot of Americans will be in Cameroon so that for their safety too. Now, I'm almost coming to an end, please, so you guys don't worry. What we need for everyone at the town hall to know moving forward, and your questions: align on the mission, structure, and logistics, mobilize participants for clinicians in Cameroon and the diaspora. You guys need to help us with that. Clarify volunteer roles and those who want to participate. We're going to answer those questions. Amplify awareness ahead of the campaign, and also build momentum and long-term cancer prevention program in Cameroon. We are truly happy, Elvis, so you are the chair today. I am truly happy that you gave us this opportunity for us to talk about what we're planning to do in Cameroon. I tried to stay brief today. You know I talk a lot, but I tried to stay brief today in order for us to have time for answers and questions. And I think it's just a matter of time. There is change in the time zone, and a lot of people are going to log in later. Really, they feel that the time, we have 32, but we feel that they feel that it's starting rather than in the next hour. So thank you very much. And please have a safe trip, everyone traveling to Cameroon. I really want to acknowledge those who will be living here and spending a lot of money in order to go home with us. Dr. Nadesh, thank you for what you do. I hope we're going to be able to use you effectively as a surgical oncologist who is a Cameroonian and who is willing to help his people. Dr. Benjamin Vabi, being a colorectal surgeon, there are others who have invited to come talk to you and gain expertise and have a partnership where you could come back and practice. Dr. Strong, for being not a Cameroonian, an American who wants to give back to her people. We really appreciate you. She's a palliative care physician and a surgeon and a surgical oncologist. Dr. Efwa Leke, we can't thank you more than we do. You're the vice president You have a very popular name. Everyone in Cameroon knows your name from your both parents who are our teachers. So, and your dad being very proud of you. I can tell you that every time we're in school, we all knew. So, not to forget about our president, Dr. D, you are a force to reckon with. And Dr. Kennedy Foyong, who is a diagnostic neuroradiologist, and he's going to be doing a practical session. He used to be the former president of RAD-Aid Africa and has done a lot of charitable work in Cameroon and donations also. So God bless you all, and I want to thank all ACPA members for participating and being part of this program. And let me stop here. Elvis, over.
Thank you so much, Mono. Thank you for this excellent presentation. I really love all the details you provided, and I feel like I should be on the same flight with your team to Cameroon. That's really, really wonderful, and you know how passionate I am with anything that has to do with giving back. And I told you I was going to tell you how I will support this. We have been talking about this backstage on different things on the ground. But personally, and on behalf of the Cameroon Town Hall for Healthcare Professionals, that we have been talking about giving back for over 2 years now, and we've seen a lot of give back projects, but this one is also very dear to me. So I'll be doing a donation of $5,000 that should go for screening purposefully for the screening aspect of your work. So that check will come to you as soon before you reach Cameroon. But you can consider that as my contribution. If I were to be on a flight with you, I think that will even be better. But this is a way to show how passionate I am to the work that you are doing. So the town hall is very proud of you people. The town hall is very proud that you are taking this leadership in giving back. And I'm sure that the Minister of Public Health himself will be very proud of you and the work you are doing, because he came to the town hall. He's been our guest, I think, 3 times, and he has always encouraged diasporans to give back. And he created an interministerial committee just to take care of diaspora engagement. So there is an interministerial committee that is taking care of diaspora engagement. They even have a website where you can actually sign up to indicate anything you are doing back home. And if you need any facilitation, they'll be there. So you can imagine how engaged the government is to ensure that diasporans give back. So I think take advantage of your stay in Cameroon, communicate well about it, take advantage of the media landscape, let people know what you're doing. And I think the government itself will be very proud of you. And please, if you need any assistance on the ground with coverages, I can always help to, refer you to people who guide you on your communication on all the media landscape. So this is really wonderful. I want to take this opportunity to open the forum for questions and answers now. Please, if you have any question you want to ask the team about this mission, please, this is the time to raise your hand, and they'll be happy to answer your questions.
Wow, Elvis, before you stop, I'll give my president a word because what you have just done is amazing. Yeah, we want to thank you, but I would allow my president to do that for your generosity. But I am still going to take your bet on the media. So if we're going to need your help. So that part, then I'll hand over to the president. So
Thank you so much on behalf of ACPA for your generosity, especially for the fact that your donation is earmarked for the patients, the population. And it is my commitment to you to know that every single franc of that $5,000 will go towards the screening of all the patients that do show up. And like Dr. Munal said, our goal is to be able to screen as many people as possible during the week long that will be there, but that does not stop there. As the funds are available, like your just donation, the patients will continue to get the screening. And hopefully, even if we're able to pick 1 out of 10 screen or 1 out of 100 screen, that is a life saved. That is a community saved. And so I'm very grateful, and thank you again on behalf of ACPA.
Okay, great. You're welcome. So it's time for questions. This is one of those days of the town hall where we get a lot of time. So please feel free to ask your questions to the ACPA team here, and they'll be happy to answer. And please, if any of the ACPA members, or if you want to add or to contribute to any other thing that maybe have not been presented by Muno or by Dr. Ndi, please, you can take the floor and just say what you want to.
Yeah, I would like to also ask Dr. Thatcher, and I think she'll talk about the research, the hands-on, and Dr. Vabi, what the things they're planning on doing, which I decided to make this very brief. I didn't want to spend a lot of time, so they can also
Yeah. And
shine some light about what
there,
will be done by the surgical team.
yeah, there was a comment in the chat about ensuring that you communicate properly back home during your community mobilization effort. Some people might come thinking that everything is free, and then if they get told that they are paying a fee, then they can start feeling maybe misinformed. So I think communication around the cost of whatever services that the population will be benefiting from should really be clear so that they can anticipate to expect when they show up. So I just wanted to reiterate that very important comment I saw in the chat.
That's a very important comment. I should be able to, let me say that the cervical, prostate, and colon cancer screening and registration is completely free. Now, from the regional hospital, Buea, which is something that is not in our control, the registration to be able to register to get the mammogram done, that is the part where I think the registration is 3,000 francs. But the mammogram itself is free to get done. But registering to get the mammogram done, I believe it's administrative process. I'm not really sure how the consultative process work in the hospital, which will be one of the things we're going to be looking at. But that seems to be what the 3,000 francs I was told will be, is that registration process. But getting the actual diagnostic imaging, it's free because it's been subsidized by ACPA.
And that's very.
I'm also told by Dr. Tambe, I think another flyer that's specifically to the community, to the population will come out, and that will be noted on there. So as they do share, they should be able to know that only for mammograms do they have that registration, but every other service is completely free and there's no fee for registration for those.
How do you plan to handle um, an overwhelming turnout? We had a program to screen for chronic kidney disease in the southwest and littoral regions, and we plan to screen 30,000 people. And we thought we were going to do this in 6 months, and in less than 3 months, we screened 35,000 people instead of 30 because of the overwhelming number of people that show up in all the 18 sites, screening sites that were set up for this project. So cancer being a very important issue, as you've already stated, we might expect an overwhelming turnout. How do you plan to deal with that? Will you have a cutoff number during the registration and limit people when the number is attained, or will you allow it open and then deal with maybe an outburst of population showing up and not able to get the services because there's too many?
Dr. Muno?
Oh, yes. So thank you very much, Elvis. And I was reading through the questions. Yeah, so it's always a good problem to have more people show up than people don't show up. I always feel in health, it shows the level of interest. And we are working with the regional hospital to make this sustainable over time. We're working with Clear Radiology also, so that if it happens that a lot of people show up, then we can manage. We can always give them appointments to come back and get their screening done. So that's some of the things. That's why we decided not just to come into the community and parachute this. We wanted to integrate it with the health system that is existing, so that this can be something sustainable over time. And then we'll see how we can do subsidizations that we are doing for those who would come up during this campaign period and actually get them screened. I know from many public health activities and what you just quoted, that at times the population may come in and we are not able to actually do what we promised. But I think we're working behind the scene in order to make sure that we'll be able to deliver. And I even forgot that the real person on the ground is here. That is my friend and brother, that is Professor Tambe, who is also an associate professor, but he's going to give us what we have been doing locally and the things that we can do to mitigate this this high turnout. But we don't want a low turnout. Yeah, truly, we don't want a low turnout. So
Yeah, it's great. There is another comment in the chat about continuity. I think that is addressed to Dr. Haggai Akumbo.
yeah, so for continuity, the reason that's a very important problem in public health. Myself being a public health physician, our biggest problem, I remember my first visits to the US was in 2008. I came in for Women's Deliver Conference. And that was the first time I asked a question and the whole UN Assembly sat quiet. It was about why is the US aid providing money rather to CDC than to the Cameroon government? And they said it was because Cameroon government was too corrupt. And I said, but you're not achieving your goals. You're not achieving your goals because that's the only system that can provide care to the whole Cameroon. And later on, things changed. And you need to have a structure which is sustainable over time. And why that is the reason we decided that this was going to be done at the government existing structure. And so the director of the regional hospital in Buea was very kind to provide us a structure. He's going to put in place a referral system. We are working with COC. That's why they're going to be present. They are the biggest cancer management team in all of the Southwest and Littoral region. We are also getting some representatives from Bingo who are managing cancers. They are being integrated into the program. So we are trying as much as possible to have a sustainable project so these people can continue screenings and then cancer care identification and follow up with the different teams, the surgical teams, the medical oncologists who are all found in the regional hospital. So, and then the university part of it, Professor Halle is here, and really it's a continuous education. We are going to build a partnership. We are going in as individuals. A lot of us work in teaching hospitals and are planning to come to Cameroon. So this is going to provide opportunity for us to build memorandums of understanding. And then Dr. Facche's hand is up, so I'm going to stop talking for her to continue.
Just 1 second. Let me add to this continuity, which I'm very passionate about. I do think that there has to be a system of referral and counter referrals. We know that patients do get lost to follow up because of, socioeconomic, their socioeconomic background. Somebody that probably live in maybe Mutengene, or shall I say, the interior of Kake or someplace like that, may easily have continuity of care if they're going to be counter-referred back to their facility, like in Buea. If, say, they went to Douala for like a specialty service, they probably don't have a way to spend lodging. It's pretty costly to pay for a hotel or find a family member that lives in Douala to continue to have that care. So if you can make sure that there is a counter referrer back to the same facility where certain other oncological treatments can happen, those patients will not be lost to follow up. And it will be easier financially for them and their families to be able to continue their care. So this particular referral and counter referral system is very important, and partnering with the regional hospital, that should hopefully scale this and make it more sustainable for the benefit of the population in the long run.
Great. Okay, Dr. Fache.
Thank you, Prezi, and good afternoon to everybody. This is an exciting opportunity for all of us on this end. I just wanted to weigh in on the educational piece. this in the research area. So the surgeon group is looking forward to have practical sessions with the medical students, partly because we believe that they really are the next generation, the people that will be driving local cancer care locally. So that's going to be part of the program, and we'll come in with a few pieces of equipment to help us really work on basic skills such as suturing and so forth. The other piece that is very exciting also is that we will be recording data, and I'm very happy that Dr. Tambe is here. As a fellow cancer researcher, we all understand that we cannot have a thriving cancer program without some locally driven research that is actually looking at our own population and designing strategy that is adapted to our local context and resources. So this is going to be an opportunity for all of us that are researchers to work together, look at the population that we are screening and see if there's anything that we can do in terms of designing strategy for better cancer care. So that's all I wanted to weigh on, but very excited to be on Cameroonian soil soon.
Great. Thank you. Thank you for adding this clarity to that question. And I think there is another comment in the chat. I want to read that comment on the chat. This comment is on data. How you plan to harness the data you all gather from this, and if that will be able to help in further developing of diagnostic tool. Is that AI tool will love if there's a plan to put the data acquired to make up a diagnostic tool, because there is not enough data for Africa, making the landscape of AI diagnostics a little biased. So I think maybe Muno, you want to speak to this?
Oh yeah, thank you. And I think Nadej is in ACPA. There is no one who is interested in data. She's a fellow. She's not just an oncologist. She's not just a surgical oncologist. She did a whole research fellow. So she is very keen on data, and our own Dr. Tambe also. So I wanted to pass over. I don't want to be monopolizing this. I'm going to hand over the mic to Dr. Tambe to tell us what they're doing locally and answer the question on data, what we're planning to do about that. Please, he's been very instrumental on what has been going on in the field. And maybe if Professor Hale has something, if not of Professor Hale and the director, this would not have happened. So Dr. Tambe, please, I don't know, I hope you can talk.
Yeah, I can talk, and hi to everyone. It's quite a pleasure, and I must apologize for joining the meeting late. So I want to thank you guys for everything you are doing so that this program should be a success. And thank you, Higai, for the interest. Believe me, we have a lot of plans to, develop algorithms, because we cannot use algorithms that were trained on data from elsewhere. Our biology is different, anatomy, physiology, genetics are all different. So it becomes difficult to take data set that were, or maybe an algorithm trained on a data set in New York and transfer to Buea. So we have as plans to also collect our own data. And when it comes to using AI in oncology, for example, in imaging, we have different equipment, be it mammograms or MRIs or CT scanners. So we need to be able to use the quality of equipment available locally, acquire images, and use these images to be able to train our own local algorithms if we really expect them to be performant on our data set. And I understand the AI hype is very, very strong, but it is also possible that a data set that has been trained on or an algorithm trained on millions of data can still miss out a single patient. So we have to be careful too with the AI hype. But of course, it's going to help us in a lot of ways because AI has a lot of different ways we can use to be able to harness. That's why you see there is agreement. A lot of countries are signing with the US. Rwanda has done a lot when it comes to harmonizing national data, creating a national database for health, because without data, we cannot talk about AI. A lot of things are going on the ground, and we are reaching out to churches. Tomorrow, which is going to be Sunday morning in Cameroon, we're reaching out to some churches to spread the word. We need to reach out to community groups, women in their community groups. Some people will get the information through social media. Some people get the information by word of mouth. Some people get the information by announcement in churches. And the preliminary flyer or banner which I made, my phone number is on it. Believe me, I've received a lot of messages inbox from out of the Southwest, people writing to ask, how is it going to look like? Can I come? One person wrote, I'm a cancer survivor. Can I come? I would like to share my experience. And I'm like, why not? Would like to hear from you and learn from your experience. So it's a ground root um, exercise because we need as many of our people to make use of this opportunity. And as Muno said, we prefer to be overwhelmed than not have enough people show up. So we would always prefer to have so many persons. And one last thing before I go off mic, I had a discussion with the permanent secretary of the National Cancer Control Committee, who reaffirmed her desire to be present on all 4 days of the meeting and actually plans to use this meeting as a springboard to launch regional multidisciplinary tumor boards, which are inexistent. So it's going to be a heated discussion on how to go about that, how they are going to function. And she also reached out, how do we, looking at our information, we are planning to do 400 fecal occult blood tests at 400,000 francs. That makes it roughly 1,000 francs per test. She asked, how do you people do it? Because this March is the awareness month for colorectal cancer. She wants to do that in other health facilities, So, and she said, whatever is going to happen during this conference, this can be scaled up to other facilities. And so we get the opportunity now to know what is happening at the National Cancer Control Committee. Of course, Cameroon does not have a screening policy, a national screening policy for cancer. So people go for cancer screening during campaigns, during health campaigns or whatever. But it becomes an opportunity now for us to share with us the idea that they have conceived at the national level. And this conference is going to become a springboard, for a lot of things to be birthed, be it collaboration with the diaspora, be it learning from the experience and see how a lot of things being done outside of the country, how those can be implemented back home. Of course, we're going to have a lot of challenges on sustainability, especially when it comes to data collection and management, because in our system, when managers change, a lot of things change. When people do not have the financial incentives about the project, the enthusiasm dies. So that's why it's good we begin with our medical students, because these are going to be the people to take over. We need to go down to the basics, go down to the roots and get these people, because we need a sustainable economy, but an economy where, or a society where everybody who is trained, they end up living. It's not going to be good for us. But whatever the case, we need that perenity in our training. So a lot of things are being done on ground, and we were willing to answer so many questions. I love Mimi's response on the aspect of registration, for a mammogram, because every mammogram you go through a comprehensive physical exam, which is going to be like our normal consultation, but the mammogram itself is free, and we need to have a way of archiving this information in the facility such that if the patient shows up 1 year later for a control screening mammogram, we can be able to have access to the previous screening mammogram. All of this is going to require logistics administratively. That's why this particular study has a registration. But the communication for mammogram is that it is free because ACPA is taking care of that, but you get a registration fee to cover just this administrative cost. But for the other three cancers, everything is free. So that information is out there. We tell people, please, the cancer screening is free. But if you need further information, our numbers are there. Contact us. We are willing to have this open discussion. We didn't want to send a mixed message because it's going to overburden our flyers. Like, oh, okay, it is free, but then you have of course, if the quarter is almost completely free and then there's a small registration cost, that wouldn't hurt anybody. So, but when we go to meet people to talk one-on-one or to talk in churches, we explain in details. But for our flyer, we highlight on the fact that it is free. Thank you. Over.
Yeah, thank you very much for this really, really important details. That's very helpful. And I hope that during your engagement with the permanent secretary for the cancer program, that you also bring the idea we've been sharing in the town hall frequently about the importance of having a functional cancer registry in Cameroon. And I hope this is an opportunity to push that agenda forward and it can get the attention of the Ministry of Health. And that could be an opportunity for them to invest resources to see how this cancer registry can function properly. I would like to call on Professor Hale. Maybe we hear your voice and hear your thoughts. And well, thank you again for facilitating this. I know you've been the machine also in the background making this possible.
Will there be time for questions?
Yeah, it's already time for questions and answers now. So
can I put a question before Professor Hale comes on?
Sure.
Okay, this is Philip Kumji. I'm a pediatrician. I teach in one of the major medical schools here. And I was in and out because I'm on duty. So one question that I've been burning to ask is, we've talked a lot about treatment. We've talked a lot about screening and detection, but I don't know whether anything was mentioned about immunization against HPV. Do we even know what the rates are for young people? If we don't prevent it, we'll still keep having a high incidence of the HPV cancer, cervical cancer, especially in women. Has the government, do we know if the government has invested any amount of money against HPV vaccinations? And the last question I really wanted to ask was, is there a role that we can play in order to in order to increase the immunization rate of HPV, educate the people, and also increase the rate of immunizations against HPV? And this, in the long run, would lead to a decrease in cervical cancers and other cancers in males.
Oh,
These were my 3 questions.
Yeah, thank you very much, Dr. Philip, for this very important question. And I think we would want to hear from the ACPA team.
Yeah, I'll take those ones. Yeah, we did think about HPV. And the good point about it is that HPV vaccine in Cameroon is now free. It's part of the national vaccination program. And this has been subsidized by Gavi and UNICEF and the other structures that exist in Cameroon. The problem we have for HPV in Cameroon is more about sensitization, miscommunication attached to the vaccine. Since it's given to girls, it was given initially to girls between the age of 9 and 11, and the rumor in Cameroon was that they were sterilizing girls. But now they have integrated boys, so it's given to both boys and girls from 9 to 11. And as Dr. Philip said, it's one of the best known strategies that have eliminated cervical cancer. Australia, New Zealand, Belgium, they are going to be having almost a 0 national cervical cancer rate based on the on HPV vaccination. So it's a strategy that the government is already using. We're going to use this opportunity in order for us to, I think Dr. Efwa Leke was very insistent about this part, and we had to do research, further research. And I think her mom was very instrumental also in making sure that this becomes part of the path. So there is a strategy we need to reinforce, we need to teach around it, and she'll be providing a lecture on that aspect, but we are not going to go in and intervene because there's already a national plan in Cameroon to give HPV vaccines. They have hindrances, especially miscommunication. Now,
Yes, and just to add to what you are saying, and that's the last thing I will say. The same problem that arises in Cameroon is it was experienced here in America. It's been experienced here. I mean, there are still people, when initially only girls were immunized against HPV here in the US, and I was involved in that. There was a lot of mistrust. They said, "But why only girls?" So that same mistrust about the vaccine sterilizing women existed here. So since then, we've actually, since boys have been included, or the young men have been included, that has sort of eased the problem. Now, one important thing I wanted to add is that we had to change the framing of immunization to put it, because many people think that is because they think that their children are sexually active. We don't want to put that. So we frame it as a cancer preventing program. That immunization prevents against cancer. Once you put it this way, hopefully that is going to change the concept.
yeah, and we would try, Dr. Philip, I think we're going for a fact-finding mission. And
Yes.
being part of ACPA, we could also integrate you into the national guidelines so you can provide advice and vision moving forward. And it's important to highlight HPV prevents not only cervical cancer. I'm talking from an oncology standpoint as an oncologist. Penile cancer rates go almost to zero. Cervical cancer, anal cancer, and head and neck cancer. So
Oropharyngeal cancer.
oropharyngeal,
Yeah.
as I said,
Yes.
head and neck. So
Yes.
this is very important that it's a preventive strategy that has taken cervical cancer from number one cancer in the US, gynecological cancer, to almost the last. It moved from first to last. Almost all cases of cervical cancer in the US are either found in underserved populations or those who just migrated into the country. That's really what we're seeing. You don't see cervical cancer among Americans born here, except those who grew up in areas where there's really the healthcare access is not good. Okay, I'll stop here.
Great. No, thank you so much, Muna. I'd like to call on Dr. Boniface for your question, and before we get to Vabi. What's the legacy?
Yeah. Good evening, everyone.
Yes.
I raised the issue of communication, and I still want to come back to it because everything, success or failures starts with proper or inadequate communication. And another issue I want to talk about is how people say that it's only women who want to come in for breast cancer will be registered. I think I was of opinion that it would be good that everybody comes and they are like documented to know how many people are coming for colorectal cancer, how many people are coming for prostate cancer, and all of those things, so that you don't go on. You have 4 days, and 1 day per screening, organ screening, which may not be really enough for that day. But hospital is a very small facility with very little space. And if we come and besides other patients who come to use the hospital, you may not have the time to do all of that. Because if you do that early, you can easily trash get a good try, and we easy for you to sort out who is who and who needs what. But if you want to put it all on 1 day, my find myself overwhelmed. Thank you so much. And again, on the issue of cost, when you say it is free, it's good to say free for free. Not that you say free and then they come to the hospital It's okay, but you see, it makes some people to do not take it seriously. Honestly speaking, we are on film. I know what I'm talking about. Thank you so much.
Yeah, thank you so much for your comments, and I think this is well taken, and I hope that the communication should really, as you mentioned, it's a sensitive issue. 3,000 is a lot of money for a lot of Cameroonians, and if somebody is leaving his house or her house, the person should know that I'm expected to pay 3,000 for a registration. And they should also know the cost of mammogram and know how much free they are getting, because they might not know that it's a very expensive test. They might think that, oh, that 3,000 is what is paying for the mammogram. They might think so. Whereas mammogram is a very expensive test that they are covering the cost. So that communication is very important. And I think the team has taken note of that. But I would like to give you the opportunity to answer his question around how you plan to triage those who are coming, and also how to ensure that the system is not overwhelmed. Yeah, maybe if I understood the question well.
Okay, I will take the first part, then maybe Dr. Tambe would help. So we are working with the director of the regional hospital strongly, and he's putting in place a team that will be able to kind of separate the daily activities going on in the hospital. And that's a very important question. We're having coordination meetings daily to try to answer this particular problem. And so our goal will be looking at the flow and making adjustments and trying as much as possible so that we can get all those who are coming in for screening triaged and either have their screening done that day or give them an appointment for subsequent days of screening. We will be registering everyone who comes in for the screening campaign. But at the moment, things may change as we move forward. But at the moment, with different finances that are getting in, we are still hoping that we're going to do the 3,000 francs registration for mammograms. Mammograms themselves is 17,500, those who don't know. Almost 20,000 to 17,500, depending on the facility. So that's a huge amount of money that is being subsidized by ACPA and our partners. So depending as things are moving forward, now that we have your donations, I don't know if other donations may come in, we may be able to cover up that 3,000, but we'll discuss that behind the scene and see. We're getting good feedback, and that's why we had to come to the town hall. So Boniface, your feedbacks have been taken into account, and we'll work on making sure that we take your advice. So I would also want Dr. Tambe and maybe any of our team members to contribute if they have something. Our president has with the executive, they have a big role to play, so they could make a statement too.
Before Dr. Tambe speak, I'll say this. As an organization, when we want to go into a community to effect change, we want to collaborate with the people that are already there and what they've already been doing. We're not going to be the first organization that's piloting a screening campaign. The regional hospital have had expertise in running public health campaigns, including breast, cervical, all of these cancers that we're trying to screen in different scales. I would say that in the initial, when ACPA first approached the hospital about our modalities, we took to their suggestion of what is best. We don't want to come in and impose, to the hospital what they need to do, because we know we're going to leave and there will be other screening that will happen, not through ACPA, probably through some other organizations that they already have certain modalities that they use. So I'm sure Dr. Tambe here, as being also part of the hospital, they will continue to take that into consideration. But this was a model that was given to us by the hospital itself, based on their previous expertise in public health campaigns.
Great. Thank you. Dr. Vabi?
Hey, good afternoon, good evening, everyone. My My name is Benjamin Vabi. I'm a colorectal surgeon, and I'm going to be a participant in this well-taught and well-prepared conference. I'll be honest with you, this conference could not be designed at a time other than, this particular time of the year, this particular month. March, as you know, is Colorectal Cancer Awareness Month. Colorectal cancer, the third leading, cause of cancer worldwide, the second leading cause of cancer death. We're talking about worldwide, not just in the US. If you look at, global cancer burdens, as a matter of fact, Cameroon, you realize that there's been an 11% rise in incidence of colorectal cancer in Cameroon in particular, right? We're talking about over a course of 30 years, from 1999 to 2017. And that number continues to go up. We've seen high incidence in younger people. So honestly, this conference couldn't have been arranged at this particular time of the year. So I'm very excited about it. I'm excited about the leadership, Dr. Munar, Dr. Ndi, from ACPA and our local team, the chancellor, the dean of the faculty of science at University of Buea, and the director of and the team at the Buea Regional Hospital. Honestly, this workshop has been well thought. I want to assure everyone that this is going to be a very impactful workshop, and we look forward to it. I look forward to, to having a very great workshop on colorectal cancer, doing some skills training and skills transfer to and also, collaborating with our local colorectal team, Dr. Mukake, and the other general surgeons who also participate in cancer operations. I think from a surgery standpoint, what Dr. Fakche had mentioned, yes, we have a very exciting surgical planning that's ongoing, starting from those knowledge transfer to medical students. We have a suture clinic that we plan to organize for them to start honing on some of those basic, surgical skills and techniques. And then Dr. Mukake is actually preparing a list of cases that we plan to also embark and, like Dr. Mona was saying, get our hands really dirty and really try to see how we can help within our capacity. So I'm really excited. I'm psyched about this mission, and I appreciate everyone that is involved in every kind. Elvis, Darcy, we're very grateful for your leadership. We're grateful for your contributions. This will go a long way. From screening standpoint for colorectal cancer, yes, like Dr. Muna said, FOBT is what we've settled on at this point. Honestly, I am looking forward to collaborating with our team, with our local team, to really challenge us a little bit. Okay, I want to challenge our local team, because if you think about even the FIT test, the Cologuard test, what it takes is that you need a stool sample, you need a reagent. Why can't we come up with our own local, testing modality? We can, we have knowledge, we have professionals, we have scientists back home that we can actually see how we can come up with our own testing screening tool for colorectal cancer. This very deadly cancer that is ravaging our younger people. So we all have this tool. That's a sample, and the reagent is something that we can partner with. We can work together and see how we can, come up with, again, the type of reagents that is unique for our people. From a data standpoint, yes, Dr. Fakches, I'm very excited about you leading on this portion. Data is key. We need unique data for our populations to be able to, again, embrace the power of AI in the future towards, whether it's cancer screening, prevention, or even treatment. So I'm excited about this project, and I want to thank all of you for everything that you're doing.
Great. Thank you so much, Dr. Benjamin Vabi. This is really amazing. You're making it feel even more exciting to go to Cameroon for this, and I hope others can really. If you are in Cameroon for vacation during this moment, please, this is an opportunity to just show solidarity to this gentleman and lady that are leading this really wonderful initiative. We have Professor Alan Tita in the house, and would like to get some comments and how you feel about this project.
Sorry, before Dr. Tita comes, I'm very excited because I didn't know he was here. This is the chair of the ACPA board of directors. So, Dr. Tita, I'm very excited that you're here, and thank you for joining the town hall.
Yeah.
All right. Well, hello, everyone. Thank you for the opportunity to speak. I was gonna sit silently like a fly in the wall, on the wall, just to listen. I'm really following some amazing discussion. I apologize. I joined in late because of another engagement earlier. I really don't have much else to say other than to applaud this initiative. Some of us on the call have had the privileged position to be at the table as this was being discussed early on, and have had the privilege to see how it has evolved, over time to what it is today. And speaking on behalf of the board of ACPA, we are just 100% supportive of this. We are fully thankful for those who have committed voluntarily time and effort to make this happen. Dr. Muno, Dr. Ndi, Dr. Efwaleke. I'm going down a slippery path here by calling names because you end up not calling all the names. There have been a lot of people on the front lines, reflected on the posters, but also on in the background, supportive, discussing different things. Like several of you, I spent my early career working in Cameroon. I worked in a very remote place called Achatugi, first 2 years after leaving medical school in Cameroon. And, saw some of the challenges that have over time become even more acute. And I know from having been collaborating over the years with the Baptist Health System, with the University of Buea, long-term collaboration and support with Professor Hale Ekane, and others, in Cameroon, who are making a very, very valiant effort to improve the health system. I know that what we are doing here counts. So, want to wish everyone who is planning for this the best. Want to wish everyone who is traveling, whether from abroad or internally, travel mercies, and look forward to the feedback from this and to the data, which will set, the steps for even more things to come. All right, let me end by saying that I recently had the opportunity to travel to the University of Arkansas in Little Rock, and had the opportunity to go to the Clinton Foundation there, and I'm looking at almost 30 years since Clinton was on, and it's really stood out to me that some of the issues that they were dealing with 30 years ago are acutely the same issues that staying being dealt with, and was giving a talk about global women's health, and someone in the audience asked this question: how are you, or rather, why would the government, and this was speaking to the US setting, be interfering with what is going on around healthcare, and ask the question, why wouldn't they just get out of it and just let things go? And I don't know what you all think and what your answer will be, but my reaction was that uh, I don't know that it's about getting out of it as much as it is about getting into it, right? And getting into it, and that ultimately our healthcare problems lie with politics, right? To have the right people who can make the right decisions, who know about what it will bring out about great outcomes. And so I say this just to say, yes, very important to get engaged. And my response was even engage more by getting the right people, into place to make this right decision. So this is the right thing to do. And I will just once more end by saying how happy and how encouraged and how thankful I am, and frankly speak on behalf of the board again to everyone, ACPA and in Cameroon, say thank you. All right, I'll stop there. Thank you.
And I was saying Chikaba in a language that will go straight to your heart. Thank you so much
Thank you.
for your leadership as chair of the of ACPA board. It's remarkable what this great organization is about to do, and this is just going to set the pace for so many other professional associations that are here in the U.S. We know of Cameroonian Association of Anesthesiologists. They have been doing great work too, transferring skill back home, and hope this is just going to really encourage other professional groups to give back. So we have Dr. Erin Strong will be heading to Cameroon. As Muno mentioned before, she is African American and going to Cameroon probably for the first time. So this is really wonderful. I want to take this opportunity to particularly thank you so much, Dr. Strong, for your interest in being part of this mission and to be part of those who are going to be providing care to those in Cameroon. Thank you so much. And maybe I give you 1 minute or two to just tell us how you feel about going to Cameroon.
Let's see. Yes, thank you all so much for the invitation. I am so excited. I am grateful to have been invited. I'm actually in my apartment in Chicago right now and looking at the snow start to come down. So it's going to be a very different climate that I'll be going to. And you are correct. This will be my first visit to Cameroon. But I have been fortunate to have so many Cameroonian friends and colleagues throughout my medical training. I have the deepest respect and admiration for who they are as people and how they share their culture. So I thank Dr. Fakche in particular for the opportunity and the invitation to come and to learn more. Again, I think of this largely as an opportunity for me to learn. And so have been reading all I can that's published in the literature about what hospice and palliative medicine looks like in Cameroon. So I am just grateful for this very awesome opportunity to learn and hopefully to share something that will be valuable to my colleagues in Cameroon. Thank you again.
Oh, great. Thank you so much. And I wish you a safe trip to Cameroon. And please enjoy Cameroon. Enjoy the food, which I know you've already eaten a lot of it from your friends here. But I think the one in Cameroon will taste different. So thank you so much. And I wish you a safe trip to Cameroon. We also have our own regular in the Cameroon Town Hall, Professor Malfobi. I don't know if he's still in the house. I would like to hear a word from you.
Professor, the old man is here. I am full of pride. I'm very grateful. As you remember, I've joined the town hall many times. I'm one of the founders of ACPA. And I remember I talked to Munoz about what about bringing the two together? I did not push, but as you see, you're together. And you're doing great things. God will guide you all. I cannot disclose because of certain restrictions whether I'll be there or not. So if I'm there, I'm there. If I'm not there, just understand. But I don't want to be on the program and take away from the notoriety of the situation. But I'm glad to see all of us coming together to give back. And I hope we'll continue doing this. Darcy and your group in the town hall, Regina and your group at ACPA, God continue to bless you all and guide you in all your endeavors. Thank you all very much.
Thank you. Thank you so much. Thank you. We really appreciate it. It's always a pleasure when we see you in the town hall. Thank you so much for being part of us. One of the centers where most of the screening will be taking place is the Clare Radiology, and Clare Radiology is a very important privately owned healthcare business in the southwest region of Cameroon. We've had Dr. Sidney here as guest speaker in the town hall, and he's been a very great part of the town hall. And is one of those whom we encourage when we talk about investment in healthcare, which cannot only be done by the Cameroon government alone. We encouraged a lot of diaspora to invest in healthcare back home. Are you opening a laboratory diagnostic center? Are you opening a radiology center, or maybe a clinic? All is investment and is part of strengthening the healthcare system back home. And so Clare Radiology is one of those structures that we are proud of. And we have Sydney here. Maybe we want to hear a word from you. How ready is your center to help in this endeavor?
Hi, Elvis. Thank you so much for putting this initiative together. Clare Radiology has been preparation, and we cannot wait for this screening to start. Fortunately, we do have quite a bit of experience in going into the hinterlands of Cameroon, doing sensitization for especially breast cancers. We have staff who are well trained, well experienced, and we're to continue to scale this effort. Because there's one thing I've always said, and I believe very strongly, is that breast cancer specifically is one of those cancers where we can make significant impact with early diagnosis because of there are management options available in Cameroon, which is what these women and our mothers are always going to ask. Once I get diagnosed, then what happens? What's next? And I know for the fact that Cameroon has management options for breast cancer. So my staff is ready to go, and I'm looking forward to given the amount of data we're going to collect. One thing that we know is going to be come out of this exercise is being able to start having a picture of the incidence of breast cancer, because we know that it's getting more women in their 30s are getting breast cancer. So I'm looking forward to some kind of a preliminary study that we're going to do for this cohort of 300 scans that we're going to do for breast cancer, and obviously not to leave out cervical, colorectal, and prostate cancer. So thank you, Muno, and I will not be in Cameroon, but yeah, it's going to be a significant impact to our community then, and I'm very proud of that. So thank you, guys.
Yeah, thank you very much, Sydney, for your leadership at Clare Radiology and for always being part of the town hall. As we are getting towards the end of the session, I think it would be very important for us to hear Professor Hale's voice. He's going to play host to this very important event. And
yeah, please, can I say something?
Yes, sure. Please.
Okay, I do appreciate that you people invite me in this Zoom meeting. I'm really sorry because I am in a meeting place. So good evening, all you guys.
We are glad to have you.
I do appreciate. Thank you. So as I was saying before, I'm Dr. Z Kakalu Florence. I'm the permanent secretary of National Cancer National Control Committee. So I really appreciate what all of you are doing, and I think those will be in Cameroon. So I think I wish really that we should have a working session where we can really discuss to see how we can ameliorate our cancer program, the care of our brothers and sisters, mothers, fathers, here in the country. So I'm sorry that I really joined your people late because I was in the middle of a meeting where I was supposed to take the floor. So thank you guys.
Wow, thank you so much, Dr. Zay, for joining this call. We really feel proud that you took time to join us and to say a word. We are really happy for all you're doing to support this project. I know you've had meetings with the team back in Cameroon, and they are really excited. Also, those who are traveling to meet with you, and hopefully together we are really sure that. The Association of Cameroon Physicians in the Americas and your organization will be able to come up with a very, very important working relationship to foster cancer care in Cameroon. So thank you once again for your leadership and all what you're doing.
I
And
think that the National Control Committee is not mine. It's for all of us. It's for all of us. That's why. So we
great,
should put it in our mind. So
wonderful,
it's our duty to make that things really goes really well for our other people. Thank you.
great.
Wow. I just want to thank Dr. Zay for her engagement, her commitment. I didn't even see that when she joined us, like we would have introduced her formally. Please, we want to thank you for coming to represent the minister. And we are very excited when Dr. Tambe told us you're going to be present. And we really want to thank you for everything you do and for accepting to be part of this initiative and to also use this initiative in order for us to take care of our people in terms of cancer wise and your openness. We are hoping the minister is also very aware of this program and he has given us his full support. And we thank you very much.
So effectively is aware for this activity. So and just to tell you guys that after the end of all what we have to do together, you have a feedback so that we can see what are the lesson learned and what can we do for other next steps.
Great. Thank you. Thank you very much. Um, as I don't know if we still have Professor Halle in the house. Let's see. Okay, I think Prof might have left already. I cannot see. Okay, so thank you so much. This is getting to almost 2 hours of being together. The town hall is always a place where we always max our time. We've never been here for less than 2 hours because it's always very interesting, very great speakers, and Professor Halle has connectivity issues, so we understand. So this is the time I'll be going around with the members of ACPA to get some last words before we end the session. And I would want to begin with the president of ACPA, Dr. D. Some last words.
Oh, great. Well, thank you again for this opportunity to share with you guys what ACPA has been doing and continue to do. We do have a lot of work ahead of us, so this is just the beginning, and we do embrace that. For all the physicians that are here in the US that have not been able to come over on board, we say welcome. We would like to welcome you to ACPA. As a matter of fact, there will be a first-hand presentation during the ACPA annual conference in Atlanta, Georgia, slated for April 24th to 26th. That's next month. You will be having a first-hand presentation of our experiences in Cameroon and to have discussions on how we shape forward the things that ACPA will be doing in the coming years. So go to acpa/cmr.org to register for this conference in Atlanta. We're also proud to say that the president of the Cameroon Medical Council, Dr. Rudolph Fonkwa, will be present during this conference next month. A lot of you physicians have had issues with registration to the Cameroon Medical Council, or just to see how collaboration with the CMC can be fostered. So this will be a first-hand meeting with the president of the Cameroon Medical Council during that conference, and an opportunity to meet with over 100 physicians of Cameroon origin during this conference. It is always usually CME accredited. What that means is your different employers can reimburse you for your registration and your attendance to the ACPA conference in Atlanta. So on that note, I want to thank everyone again on behalf of ACPA. We have a lot of work to do, and collectively, we're going to get that done. Thank you.
Thank you so much, President, and thank you for your leadership. We'll get to some last words from our own Chair Square. He is the chair of the outreach of, the program that is going to take place in Cameroon, as well as the chair of the town hall. Mono, you're always very great, and thank you for your leadership at the town hall as well, for all you do. And I'm so thrilled with your love for home and for always trying to make sure that Cameroon get the best. So maybe some last words from you.
Well, Elvis, thank you very much. I would start by thanking you for your generosity, really, and I don't know exactly how to say it. Your heart got moved with this project, and you've supported us with $5,000. In Cameroon, that's almost 3 million CFA that you've given us. We are not going to neglect that. We appreciate you for all what you do. In the name of the town hall, you've done a lot. I think we had supported cholera programs in Cameroon in the Southwest region with the delegation, supported COVID programs. We have done a lot of support to different programs and different initiatives. We have supported the students of the CAMESA, which is Cameroon English-speaking medical students. We supported their health campaign last year, and you did a lot of that contribution. And ACPA is looking forward to make partnerships and work with some of those organizations in the future. So those are all things that I want to, as the medical mission person, I've seen what some of those student organizations have done. We'll try to contact some of them in the future. But I just want to thank you for that. I also want to thank the board, ACPA board, for the contributions, the money they provided for us to be able to do this trip, and for us to be able to do the screening in the first place. And really, our team at the Medical Mission, we are very grateful. And I also want to apologize to my team at the Medical Mission. They felt maybe left out, but we're going to work in the future, because communication has mostly been among those who are traveling back home. Now I have to thank our partners back home. I would love to thank Professor Halle, because this initiative came initially by contacting him, and he's very open to all forms of collaboration and providing his institution, and also providing his partnership. We could not do this without the director of the regional hospital, who is not here, but I think we're having a coordination meeting tomorrow. I hope it's going to be brief and he'll be present. Then no one other than my friend and colleague, who is also Professor Joshua. He loves to be called Tambe. And he is, without him being present, this could never have happened. He contacted everyone in Cameroon who is going to be present in this organization, went to the ministry, saw the permanent secretary, who is present here today, Dr. Nze, and we are so glad to have her here. And the minister knows what is going on. I don't want to disclose those who have been working behind the ministry in order to get this also done. So thank you all. And I would love to thank our colleagues who are traveling from the US. And I really appreciate that you guys could sacrifice your time, money, and everything to be present during this great fact-finding mission and cancer screening. Also, I would love to thank our partners that you would see on the flyer. Some of them have just been quiet. I would have expected them to talk. Dr. Tonsi, who is at Bingo, who will be present. He has presented at the town hall many times, and he's going to be there on day one and give us their perspective. No cancer center sees more cancer patients than Tonsi, sorry. And then you have the COC will be present, Cameroon Oncology Center. They will be present also. And we have all the different faculties from Buea, from Yaoundé, like Raymond, who will be coming in from Yaoundé, Faculty of Medicine, Tim Fabrice from Faculty of Medicine, Bamenda. They will all be there in order to help us. Also, the Faculty of Science would have some representatives who will be there. So a real big thank you. And then I want to thank all those who are here today. Can you help to share the word? Pass the information. We're going to do our best. We have tried and done a lot of things in Cameroon, but it's always learning. We have had a lot of fight and pushback. You will not even imagine. Doing a project in Cameroon can be very technical because it's we don't want to talk, but there's always a lot of pushback. There's complexities that you cannot even imagine that can take place. But the Minister of Public Health promised us yesterday that if we have any hindrance, he's going to be able to act as a middleman so that this project can go very well. Personally, I want to thank Elvis for making sure that the minister knows and acknowledges that we are going to be there. So really, thank you. Thank you, everyone, for coming to the town hall today. And please, God bless you all. Just pray for us, support us, and let's get this going. Long live ACPA. And thank ACPA for the help it gave me to integrate into this community in the US, and we'll continue to give back. We have a lot of things that we're going to do in ACPA, a lot. So this is just the beginning, the tip of the iceberg, I think so. So we have a lot of collaborations in the future, Elvis.
Thank you so much, Mono. Thank you for your leadership always. Ladies and gentlemen, thank you so much for joining us in today's session. Today's discussion really reminds us that improving cancer care in Cameroon will require more than individual effort. It will require collaboration, knowledge sharing, and a sustained commitment of giving back to our people. So the upcoming ACPA 2026 Cancer Screening and Education Program in Buea is an excellent example of how diaspora and professionals at home can work together to strengthen prevention, early detection, and clinical capacity building initiatives. So this is one of those initiatives that demonstrate that when we combine expertise, partnership, and purpose, we can really create impact. So let us consider this conversation a beginning of a continued engagement with Cameroon Town Hall, and that together we can continue to shape cancer care in Cameroon. Thank you so much, Dr. Ndi, once again for your leadership. And everyone, I wish you a very nice weekend. But know that this session will be transcribed and hosted on our YouTube channel, and we can share the link so that those who were not opportune to be here can watch the session. And it was also streamed live on our Facebook page. So thank you for being part of the town hall, and I wish you a very excellent weekend.